my full name is Joanne Amara Sinei. I just grew up in Makongeni. I went to the Kakamega Secondary School. But God is great. I have been representing Kenya in silence. I've worked in this globe. I call myself a globetrotter. I've worked in 13 good countries. I've worked in Asia. I've worked in West Africa. And most so I worked in Afghanistan, where I got empowered to open this organization. I think you've just heard about a slide. I'll not repeat again, but again, I'll give a short number of why I decided to open this launch. Currently, I'm working with the Norwegian Refugee Council in Nigeria as a deputy country director in charge of 70 INGOs. Very important, not local NGOs, but international INGOs. You can mention a few, like SCF. I know most of you work in this platform, they know that. So, why I started this journey, you can imagine, I'm from Kenya and I'm in Afghanistan dealing with Taliban. Women are not supposed to work. It was a global catastrophe. The donors were refusing because it breaches the humanitarian principles. I fought for women in my organization. That time I was working with SCF. I really fought the Taliban, and they were like, who is this woman from Kenya? So in silence, I was representing the Kenyan power, the women in power in Kenya. So I made sure my organization has women, being not blessed with men in my organization. That's why I felt, in Kenya I'm empowered. I can walk free, work everywhere. And I congratulate the legislature for putting a constitution whereby I can see an eighth of women enjoying the seats in the parliament. You can see Honorable Pasaris is here, Karen Nyama and the rest of the people. I emulate Kenya, and Kenya is really appreciated out here. You should know when you go out there, there are so many Kenyans who represent Kenya in silence. So yeah, that's why I felt I've given enough from outside. I've been working with affected population, vulnerable population, giving sexual and reproductive health activities, GBV, why not in my own country? Because when you look at Kibera, there are needs. If you look at Kariobangi, there are really needs of this kind of services. That's why today I said, after I opened my organization in 2022, I need to launch it and make it visible for our stakeholders, for members of parliament to give support in this initiative. Today, we are gathered here to celebrate the official launch of Health and Assistance International, an organization driven by a deep commitment to improving health access. Accessibility is an issue, not only in Kenya. Go to Marsabit. Healthcare workers, there are no human resources. People struggle to see a clinic, so why not do this in my own country? Fostering community resilience and advancing health rights for all. The launch is not just the beginning of an organization, it is the continuation of our vision that prioritizes dignity, well-being, and sustainable change. So I want you to know who HAI is. HAI is a Kenyan non-governmental organization dedicated to ensuring health accessibility for all, particularly for marginalized and vulnerable groups. Since our inception, we have been in the forefront of initiatives that bridge the gap between the policy, the practical health solutions, striving to create a society where no one is left behind in accessing essential health services. Our focus is on communities that struggle with limited access to healthcare, including those informal settlements like, as I mentioned before, I don't want to mention again and again. Rural areas, we have cohorts in Kakamega. We are doing something, Madam Helsi. I should put this across to you. We have some cohorts in Kakamega. They are doing livelihoods, they deal with orphans, vulnerable population, and they've done very well. We have done about livelihoods, and we have like 1,000 poultry, and also we have 50 acres we want to plant maize. So we want your support to help us in this cohort so that dream is achieved. And this cohort is about orphans, widowers, and those ones who are more vulnerable. So that is one of the cohorts that we have as HAI. HAI is guided by a clear vision and mission. This is to enhance access to quality healthcare services to the vulnerable population by providing direct interventions, advocating for policy change, and strengthening the community-driven solution. We are not leaving out our vision, where even individuals, regardless of their backgrounds or economic status, has the rights and ability to live a healthy and dignified life. As my HR was here talking about our thematic areas. We are a women-led organization, so we looked at the themes that can support women. And the women we are looking at, they are teenage girls between 15 and 24 years, and also women under the reproductive age. We have sexual reproductive health. Without SRH, you cannot go away with GBV, which is the gender-based violence. I appreciate Honorable Kamaru, who is here. She is in charge of gender-based violence. I think we really align with the government protocols when it comes to gender-based violence. I'm happy for you to be here today because I know you come to us to have partnership. I'm really humbled and thank you for coming. So without leaving out MHPSS, that is mental health and social support, I'm also humbled to have the chairperson of Kenya in our presence, who is the chairperson of Mental Health Association in Kenya. Thank you very much, madam. So in a nutshell, we have SRH, GBV, MHPSS, but again, we have interwoven activities, integrated activities. Without water, there's no good health. So we do a lot of wash activities, and also economic empowerment activities, as I mentioned, in Kakamega, we have these cohorts. Leave alone all those that I've mentioned, we have also advocacy and also policy engagement. Those are the thematic areas where we venture in as high. I will take a pause again just to mention the cohorts that we have. I've mentioned about Kibera.